Femtosecond laser is an exciting new technology that's being used in ophthalmology. It's been used mostly because of the ability to target very, very small regions of tissue and with very ultra short pulses of light that enables us to disrupt some of the tissues, enables us to make very specific cuts in very small areas of the eye. Femtosecond laser has been around for a little while. It's been mostly known for its use in laser vision correction surgery, or LASIK, and that is the ability to reshape the front surface of the eye, the cornea, in order to incorporate a person's eyeglass or contact lens prescription so they can see clearly without glasses or contact lenses. The recent advances in femtosecond are now using that same technology in things such as cataract surgery, and that is to make incisions on the cornea and in the eye, on the capsule and in the lens, to enable us to remove a cataract. Cataract surgery is when the lens of the eye, inside the eye, instead of being clear when we're young, eventually becomes opaque. And that eventually disrupts the vision and the ability of light to enter the eye. It's a normal process of aging. Everybody who lives long enough will eventually get cataracts. And if they live long enough and it really bothers them, then they'll get those cataracts removed. So that's what cataract surgery is removing that lens and replacing it with an intraocular implant. For the last 30 years or so, the way that we've done that is by traditional microincisional surgical techniques. So using things like blades and needles and things like that in order to access that part of the eye, and then to use ultrasound to remove that lens. What femtosecond laser does right now is it enables us to make those incisions using a laser instead of those blades. So there is some controversy as to whether there's a significant improvement in efficiency or safety with the use of the femtosecond laser, but it is a technology that's now available to us. Usually this is not covered by insurance, so this is a premium cost. It's something that we can offer to a patient, but it's usually an out-of-pocket cost. The cost of the laser is significant, the maintenance of the laser, and then there's what we call the use of the laser, so a click fee, and so that cannot be charged directly to a patient. Medicare rules state that that's not something that can be an additional cost. However, it can be bundled in with what we call a premium lens, and these are special lenses that are put in place of the cataract in order to enable one to see a little bit more clearly. So that bundling is what enables us to use the femtosecond laser. Currently, there are no large studies to show that there is a definitive advantage in terms of safety or efficiency. Currently, it's actually not very efficient to use this simply because it's a technology that requires additional instrumentation, additional procedure in order to utilize it. The theoretical advantage is that you can make very, very precise incisions and a very, very precise opening in the capsule that you can predetermine in order to center an artificial implant in the eye. So that is the advantage of using the femtosecond laser. Endophthalmitis is one of the greatest fears of the cataract surgeon, and that is a fulminant infection inside the eye after surgery. That can happen the fortunate thing is it's a relatively rare thing. Less than 1 in 1,000 patients will be at risk or have an endophthalmitis, and if it's caught early enough, then that can be treated. It's an infection that can get very bad very quickly and can turn what was once an elective procedure into a eye-threatening or vision-threatening condition. And for that reason, it's something that we are very, very careful about in preventing. The theoretic advantage of making smaller and smaller incisions using a femtosecond laser are that you would decrease the risk of this type of infection. Again, there are no studies so far that have shown that that is the case, and we're already in very, very microincisional size incisions.